a little bit about CHF. For those of you not familiar, we were founded 35 years ago, and today we lead a national network of 25 programs in 15 states, DC, and Puerto Rico, that bring comprehensive health care to children growing up in under-resourced communities. And we advocate for the health and well-being of all children. Our partner programs provide comprehensive health care. And what we mean by that is medical, mental health, and dental services, as well as addressing health-related social needs or social determinants of health. And we do this through a fleet of more than 50 mobile clinics and telehealth services, and providing services at more than 500 schools, homeless shelters, and other community sites. So today's topic, oral health. Why oral health? Well, oral health is vital to the physical, mental, social, and economic well-being of children. The mouth is the gateway to overall health. In fact, dental caries are closely linked to obesity, diabetes, and heart disease, among other illnesses. Nearly 1 in 5 children have untreated dental caries. And the American Dental Association estimates that 51 million school hours are missed every year due to dental-related illness. And unfortunately, like other health-related outcomes, there are significant disparities. Children living in low-income households are twice as likely as other children to have cavities, twice as likely. And children of color are more likely to have dental illness than white children. So we are fortunate today to have with us 2 special guests, Dr. Adam Hodges, who I've known for more than a decade for sure, and we've worked together in the past. He's the dental director of the Idaho Children's Health Project. This is one of our national network partner programs. And we also have with us Mr. Aaron Houston. He's the CEO of Family Health Services, the federally qualified health center where the Idaho Children's Health Project is based. So I'd like to start with you, Adam, and maybe you could say a little bit about the patient population that you serve in Idaho through the mobile dental clinic. And thank you for joining us again.
Thanks, Arturo. It's always good to see you. And we love our partnership with the Children's Health Fund and the good people that are there. Talk a little bit about what we see here in Idaho. We are a rural community health center. Aaron's going to talk a little bit about that, but what we see is children and adults across the board as a community health center. But we do see a lot of children. A lot of those children come to us, and they are migrant children. So we're a migrant, federally qualified migrant community health center. So we have a lot of children who come in from various parts of the country. We particularly have in our service area right now a refugee center. So we see a lot of people coming to our communities from places far away from Idaho. And so we have a lot of issues to deal with by way of translation and getting communication with those patients who speak Swahili and Farsi and other languages like that. I guess the real question I would say is, Arturo gives some awesome statistics. I think what's really interesting about healthcare, though, particularly oral healthcare, is that 80% of everything that I have to fix as a dentist is completely preventable. That everything that we have to do for fillings and crowns and root canals and all that, it doesn't have to happen for children. And I was thinking about this the other day. I had a little girl in the office, a 10-year-old patient. She got her permanent front teeth in, and they were beautiful, straight and just beautiful teeth. And I commented to her, I said, do you realize that those teeth you have right there, when you're a grandma, that your grandchildren will look at those teeth when you smile at them? And it really depends on how you take care of those teeth and what you do to protect those teeth and take care of them throughout your life. That'll make it possible for you to have that beautiful smile when you're a grandma someday. And so for me, what we see is we see a lot of children who come in who have poor oral hygiene and poor kind of dental IQ. No one's really given them a good understanding of what's happening with the disease process in their mouth. And we find that if we spend enough time with them, have them come to regular visits and cleanings and whatnot, that they are able to maintain good oral health. In fact, our program right now has had, I don't have the statistics, but I have a lot of patients that I've been seeing for 15 years who I saw as little kids with cavities, got their cavities cleaned up, got them through braces, got them into adulthood, who are living a good functional life with beautiful teeth. So we see a lot of variability in the cases that we see, Arturo.
Yeah, thanks, Adam. And we'll come back a little bit in a second after Aaron talks about family health services. But I do want to talk about how the mobile clinic itself is helpful to you, and particularly because I've been out there before to your area and worked with you, and thanks to you, did a site visit. And for people to understand how rural this part of the country is, and without these dental clinics that are mobile, you wouldn't be able to provide the services in the way that you do. So we'll come back to that in a second. But maybe, Aaron, people listening, not everyone may be familiar with federally qualified health centers. Can you say a little bit about FQHCs and family health services specifically, and why this relationship with Children's Health Fund is important to you and the residents of your community?
Sure. So my name's Aaron Houston. Really appreciate being a part of this. As rural Idaho, we don't have a lot of population, and so it's really exciting for us to be able to partner with like Children's Health Fund to bring us outside of just these really small towns in Idaho that we serve. We're based out of Twin Falls, which is about 2 hours east of Boise, and we are throughout what we call the Magic Valley. We have about 8 health centers or sites, and we are a federally qualified health center, which means that we get some federal grant money. Comes with a few strings, mostly reporting, but what it really provides is a discount for patients that don't have health insurance and who don't make a lot of money. And we also accept Medicaid, which a lot of dentists in our area do not accept Medicaid. And so even though a child or a family might have coverage, they don't have access to a dentist. And so our focus really is taking care of those underserved families, kids, to make sure that they have access to healthcare and access to dental care. So we are very excited. We've partnered with Children's Health Fund for almost 20 years. And in that time, our mobile dental unit has been instrumental in being able to establish new dental clinics in some very rural towns that otherwise would not have access to dental at all. So we're thrilled to be partners with Children's Health Fund. And so I'll send it back to you, Arturo.
Yeah, thanks. And again, Jill, I don't know if you're able to put some of the slides up there, because I want to make sure that people understand when we're talking about these mobile clinics, that we're talking about 38 to 42 foot long vehicles where Dr. Hodges and other dentists, the dental hygienists, the whole team work on. And these are basically mobile dental, in this case, dental offices on wheels. In other cases, we have medical offices on wheels, and a combination of the two, of medical dental. And then within these, again, the services are comprehensive to the children and families seen on these units. And so you see the pictures there, just to give you an idea. There's Dr. Hodges at work, and they are, fitted and designed to meet the needs of the community. And we certainly do that in Idaho and throughout the country. So Adam, I've learned a lot from you and other pediatric dentists about what pediatricians should be doing to guide parents about dental care for the children. What surprises a lot of parents, and even pediatricians sometimes, is how early one needs to start. Can you say a little bit about some of the guidance that you provide and that you also share with our national network of partners to inform parents about early dental care and why that's so important for children's healthy dental development?
Yeah, sure, Arturo. I think I think we complement each other, the dental community and the pediatricians. What you find is that a lot of parents don't recognize the importance of timelines with babies. So if you have a baby, we like to see babies at 6 months, And it's not just because my staff all loves to hold and take care of little babies, but it's because we know that the earlier we talk to a mom, the more we can increase their knowledge of what needs to happen for their child's oral health. So we spend the first visit with them at 6 months of age. We do what's called a lap exam, where mom holds the baby and just puts the baby's head down onto my knees, and we just use a little. I have a little light on my glasses, and we look at the baby. Even if they have just 1 or 2 teeth, we begin talking to mom about how to care for those teeth, what kind of toothpaste should be used, how much toothpaste should be used, and then we go on to talk a little bit about feeding and snacks. What people don't realize is that there are certain things that are very highly cariogenic, and so we talk to the parents about those kind of foods. My big no-no foods are always going to be fruit snacks, raisins, anything that's a compressed condensed sugar that can stick to teeth. We shy parents away from those kind of snacks. We talk about how to brush the teeth, care for the teeth, and then a big one for us too is looking at feeding times for babies. Right, like once they hit a year, pediatricians will start talking to parents about weaning the child off of the bottle and off of the breast. And we reinforce that with mom because taking the child off of the bottle at the appropriate age encourages them to develop their tongue in different ways. People don't recognize that a baby drinking from a bottle uses, or from a breast will use certain muscles within their tongue and their cheeks. But if they have to drink from a cup, it uses a different, I'm not talking about a sippy cup, like a regular cup. It makes them have to start to use different muscles, and it helps to increase speech and helps them with their development. Also, as we move from milk to more solid foods, what are we doing with the solid foods? What kind of foods are we choosing? What kind of snacks? Goldfish crackers can be every bit as damaging to teeth if they're given at will, and children can eat them all day long, right? So we need to have nutritional consultations with parents and children, and then like hygiene, like how do they brush their teeth? When do they floss their teeth? We go through all of those kind of patterns with the intention of preventing issues. We also work with our medical teams. At times, it's been a little bit difficult for the medical teams because they get so busy with everything they have to do with all the immunizations and all of that. And so we work with our medical teams to talk about fluoride varnishes. And we've had, in some of our clinics, we've actually put a hygienist in at times to try to help increase fluoride varnish access to kids. Another thing we do in our clinics that works with the mobile clinic and works throughout the health center is we have a program right now where we're trying to get children immunized. So we started with the HPV vaccine, which is a big deal, right? Like people don't recognize that HPV is one of the leading causes of oral pharyngeal cancer, right? And if you don't get a child those vaccines, usually I think it begins at the age of 9. I think we start asking our patients at the age of 10. But if they get their doses of Gardasil or the HPV vaccine prior to the age of 13, they only need to have two doses of that, and they're protected for life from HPV associated oral pharyngeal cancers. If they wait till after the age of 13, they have to do 3 doses. So we work with our clinics to kind of synchronize data, make sure patients are being seen for their vaccines, particularly HPV. But we also look at the other vaccines as well. So we try to look at the patient as a whole and recognize that we can't just separate that little mouth from the rest of the body. You know, that little mouth has an important role to play.
Adam, I'm smiling because sometimes I struggle to explain to people what we mean by comprehensive healthcare. And in what you just said, it's clear. As a pediatric dentist, you are talking about HPV vaccines, a vaccine that is not well received by a lot of families, not well understood. And yet you've had a success rate. If you want to talk a little about that, with that vaccine, but the point is here that talk about comprehensive healthcare. You don't just, you use the mouth, oral health as the gateway to overall health in the most effective way. I've never seen something like this before. I wish I had kids because I'd come to you right now to take care of their teeth and everything else, because it's clear that you're very comprehensive. Can you talk a little bit about the study that you all did with the HPV vaccine in your community? And because I think it's important for people to understand that providers like yourself and our national network are not only dedicated, very skilled and very knowledgeable in areas even beyond what you would normally expect. So if you could say a little bit more about that study and what the results were.
Yeah, so it's still a work in progress, unfortunately, but it is difficult. We live in a very conservative state. Idaho is very conservative. And so, when we start having these conversations with parents, you have to be very clear that, you're talking about HPV from a cancer prevention mechanism, that this is something that if you could say to your adult child, when they become an adult, hey, we did something to try to protect you from getting cancer. Any one of us who've had family members who've had cancer or ourselves have had cancer, we recognize, right, that if there was a way to prevent that, we would do it. And so we went to our patients and we talked to them as they check in. We actually look them up. We look them up in IRIS, which is the state immunization tracking program, and we see who is deficient in those, who hasn't started them, who's up to date. If they're up to date and current, we don't have to really do much with them. But if they're deficient, they need a dose or two. It's a pretty easy conversation to say, hey, there's a vaccine regimen you started or haven't started that we know as dentists will prevent cancer, and they can prevent cancer down the road in life. And so we want to make sure that you're getting it with your provider. We will contact our medical teams and try to get them an appointment if they're deficient, try to get them scheduled for that. Where we kind of have a little bit of the loop missing, and one of the things we're working on right now is we're trying to follow up on percentage, and it's so hard. I mean, everybody knows that works with electronic health records, right? You can get it to do what you want it to do, but you got to jump through a lot of hoops to get there. And so what we want to be able to do is say, okay, who are the patients that we referred back to medical? Of the ones we referred back to medical, how many ended up getting their vaccine? And so we're actually in the process of that part of our study right now. We've done really well at getting the education, talking to the parents on the dental side, but we're just trying to figure out how to close that loop to see how many that we talked to actually got their vaccines current. And the reality is that if they're missing the Gardasil or they're missing the HPV, they're probably missing another one too, right? They're probably missing their meningococcal or some other one that they should be getting as a teenager. And so we're trying to kind of like close that all up. So they're like, hey, you're at the health center. It's the same if I have an adult patient who comes in and they have hypertension, they immediately get walked over to the medical office, right? It's the same principle, right? What do you need? What can we help with? And the same is true if I have a medical, person at the health center who has a child who comes in, we expect them to just walk them over to our office and say, hey, I've got this little child here who needs care. What can we do, right? And so we do that. We do that a lot. That's one of the beautiful things of being in a community health center is that we can help those patients, whether it's behavioral health, dental, medical services. If they need an outreach and enrollment person, help them see what services are available for them. If they need help with food services, pharmacy, we keep all of that in-house. So we can help patients get that access.
Yeah, thanks for taking the time to explain that, because I remember, as you know, and Aaron, I'm going to come back to you in a second to talk a little about the use of the mobile clinic in a different way in the Idaho program. I worked for more than a decade as the medical director and the pediatrician on the South Florida Children's Health Project, one of the affiliated programs with the Children's Health Fund. And people would often ask, well, they're mobile, but then how do you get continuity of care and all that? Well, what people don't understand is that we would go to the same sites on a regularly scheduled basis, just like any practice. You'd be open, this office 2 days a week, this one 2 days a week, and we'd be available to patients like any other practice would 24/7. So it's about really providing a mobile, it's a medical home or a medical dental home for these children. And in Idaho, I know, Aaron, that you guys have used these mobile dental vans in a very unique way. You provide that continuity of care, but my understanding is you've also used them in a way to establish where you may want to build the next fixed site clinic, depending on need, and use that. Now, can you say a little bit more about that?
Sure. Yeah. I mean, sometimes it's a little bit of a chicken and an egg. Is there, we feel like there's a need and a demand that's not being met in a rural community. And so the mobile dental unit allowed us to go out and, like you said, it would be there, not just one day a month or something like that, but we would use it and be able to hire a dentist and establish a dental clinic based on the needs of what we saw in the mobile dental unit. And so we actually opened a dental clinic in our Buell community, in Twin Falls, in Jerome, all being able to establish patients and see them on the mobile dental unit, and then have a fixed site. And so we actually are in communication with another local community that's very small, rural, doesn't have access. It is at least half an hour to drive to the local dentist. And so we are in discussions about utilizing the mobile dental unit to come out and give those patients some dental care, and then use that to write grants and show the need and establish a full clinic, not just a dental clinic, but a full clinic, but all based on the use of the mobile dental unit to show that there is a need that we can fill.
Yeah, thanks, Aaron. And you know, one of the things that we're constantly told, and Kelly Rigney, our VP of programs, is here, and she hears us all the time from our national network partners, that what we bring, our funding helps them mostly with, is to build and try new things. Innovation is really important, because without that, you know, even when you do have the federal funding or other types of funding, it provides for some of the healthcare services, but not all of them. And in this way, and I think in the way Adam has described, some of those things are trying out. And I want people listening to understand that has to come from grant funding. So I guess my question, first I want to ask Jill, do we have any questions pending right now? So if not, I'm going to go right to Adam and then Aaron to ask them, if there were extra funding made available to you, what would you do with that in the context, obviously, of what you're doing with the dental care of the kids in your community? So let's start with you, Adam. What would be your dream?
You're muted, Adam. We want to hear your dreams.
Oh, I looked like a fool there talking, didn't I, Kelly? I don't know if I have any like huge dreams. I think one of the things that I think people need to recognize is the sacrifices that a lot of families have to make to get care, right? I don't think people realize that. Social determinants of health are real. They are real. And even though people throw those numbers out and they talk about social determinants of health, which is what we use to look at needs in communities, we've had communities where people had to drive as far as 3 hours sometimes to get dental care. An hour and a half, 2 hours. And you think, well, that, you know, everybody's got to make their sacrifice for where they live. But the reality is that that's a day loss of work for a family. And for a lot of families in poor communities, they might have one car. And if the dad takes the car to work, the mom's left at home with the kids. And so, you know, continually looking at opportunities for us to go to communities that no one is seeing anyone who has, nobody who's on Medicaid, or nobody's there doing services at a slided fee, or there's lots of opportunities for us. We have a few communities left within our service area that we could definitely be looking at to take more services to. And I think that's where I would focus on if we had additional funding, would be to be able to get some of these even more remote, smaller areas access.
Thanks, Adam. Aaron?
You know, we have seen a really interesting shift very recently, where there have been very little federal grants and money to expand services. And so we've not received one of these expansion grants at Family Health Services for about 7 or 8 years. And so communities are starting to help with that. So we opened up a new clinic because the community came together and raised the funds. And as we talked about this other community we're going into with the Children's Health Fund and the mobile dental unit, it's actually the community that is raising the funds. We've talked with local government and the county, and they're going to raise a little bit, but most of it's going to go back to the businesses and stuff. And it'll probably take, you know, years, 5 years, maybe. I think that's our timeline. And, you know, and that's kind of unfortunate that it takes that to bring needed just dental and medical services to a community, so that these families and these kids don't have to, like Dr. Hodges said, they don't have to drive 2 hours to come see us, where it's affordable healthcare if they don't have dental insurance. And so that would be our dream, would be to have clinics in the locations, in these towns where people live. And so it's not a full day pulled out of school. It's not a day off of work. It's not until the teeth are so bad that it's painful and the kids can't sit through school and learn, it's come just over across the street, because that's where the dental clinic is, and they're right back in school, and parents are right back at work. So
Thanks, Aaron. Yeah, I want to thank you and Adam again for joining us today and for partnering with Children's Health Fund for so many years. As I hear both of you talk, it's really a reminder how we have to let others know and educate others about disparities we have in this country. And that, again, when you see that kids living in low-income households are twice as likely as other children to have dental caries, and when we understand the connection between oral health and overall medical or physical health, overall mental health, overall psychological and socioeconomic well-being, there are some challenges we have in this country to ensure that every child has the best chance to thrive and succeed in life. And I'm thrilled that we partner with you and our other programs around the country, and we welcome others to join us in this effort to eliminate the health disparities that we have in this country that we all agree shouldn't be there. I want to thank our listeners for joining us today. The next session we're going to have, I hope you can all join us, is going to be on December 14th. It's a Wednesday at noon. And the topic for that Children's Health in Focus is going to be living with trauma, caring for immigrant and refugee children. The vast majority of our programs see a substantial number of children who are either immigrants themselves or living in households where the families are immigrants. And we have huge challenges there, and we're addressing them. We're bringing the healthcare directly to them in communities throughout the country. And we hope you can join us and share your ideas between now and then or after that for how we can work together to make sure that every child in this country has the opportunity to thrive and succeed in life. So thank you again, and everybody for being part of this. Much appreciated.